Introducing foods to your child can be a very exciting or stressful time. Parents have a lot of questions around this. Question number 1, when can I introduce food to my child? Now the recommendation is usually around 6 months of age, but not before 4 months. So generally any time from 4 to 6 months should be okay, but it depends on a few things. The main thing to think about is how your child is going developmentally. Before introducing food, it's really important that your child has very good head control. So if you sit them up, they should be able to hold their head up by themselves. The reason for this is so that they have a safe swallow and that their head isn't moving around the place when they're trying to eat. Now the next thing to note is that the child needs to be interested in food. If a child's not quite ready to introduce food, you might notice that they push their tongue out and they're not interested in taking the food. Once they start looking at food, see you preparing food and show some interest in what other people are eating, and they don't stick their tongue out when you try and offer them food, then you know they're ready. Now this doesn't always correspond with the parent being ready because it can be quite a big step. So make sure that you're both comfortable before you go ahead. So what food can you introduce to your child first? It can really be anything soft. Now traditionally people have introduced rice cereal, but something like a vegetable puree or even some fruit that is pureed can be very well tolerated as the first foods. A lot of people are leaning towards what we call baby-led weaning, which is where children have more autonomy and they can actually hold food with their hand and eat. If a child doesn't have teeth, gnawing on hard sticks of food is a good way to start baby-led weaning. So things like celery sticks or sticks of carrot that they can just chew on, mostly for fun. If you'd like them to eat some sticks of food, they need to be really soft and easily mushable between your fingers. Now, choking is a big parental concern with starting foods, particularly with baby-led weaning. The most important thing to note is that a bit of gagging is okay, and in fact, it's actually normal and shows us that the child has a good gag reflex. So you may find that the child gags a little bit and clears their throat and then they're happy and keep going. Choking is more of a concern, and that may look like them struggling to breathe and struggling to get air in. It would be a good idea to have a read up on how to manage choking before you start giving your child food. Essentially, the key to that is back blows, so having the child on your lap and giving them some blows on their back. Other parental concerns with starting solids include nutrition. Now, a lot of children under 1 may eat very little food. Some eat a lot and some eat hardly anything, and nutrition is a big concern for parents. The main thing to note is that less than 1 year of age, children mostly rely on milk for their nutrition, whether it be breast milk or formula. So don't be overly concerned about nutrition, but just be aware of it. As long as your child is growing and putting on weight and developing normally, then the amount of food they're eating under the age of 1 is fine. But of course, if you're worried, you should speak to your GP or your maternal child health nurse. Fussiness is also a big concern for parents, and it's important to get in some good habits early. We will chat about this with the Wholesome Doctor shortly. And finally, allergies really concern parents with introducing food. The main message that I want to talk about right now, before I speak about allergies in more detail, is that early introduction of allergenic food is the most important thing for your child in terms of reducing the risk of allergies later on. And I'll talk a bit more about the allergenic food shortly. So the main thing with introducing foods is go at your own pace, have fun, be prepared for mess, be prepared for good days and bad days. It's not going to be an easy, straight line with introducing foods into your child, but it is a really, really important step for their development and for how they see food going forward. And seek help if you're having any trouble at all.